Hello, everyone. My name is Shelby Blaisdell, and the topic I chose for our article presentation is testing anxiety in students. So the article is about how dynamic testing affects the anxiety level in students. So dynamic testing is a system that has been created to help with pre-test training and pro-test design. So basically, this method of testing is designed to measure the child's potential for new learning rather than measuring their previous learning experiences. This technique involves a hierarchically structured approach in which children receive a graduated series of prompts um, that become more specific in relation to the solution task with each new prompt. So basically, they're getting prompts that are more guided towards what they're learning and what they're going to learn in the future. What is test anxiety? Test anxiety has been described as a negative emotion or cognitive response to a situation in which performance is being measured or assessed. So, test anxiety is just when students are worried about a test, and this can cause them to do bad on a test because they're so worried about it or they're so anxious about it. Um, um, the consequences of high levels of test anxiety are well known, ranging from underperformance on standardized tests and lower performing groups in schools and dropping out of school altogether. So, testing anxiety can cause kids just want to quit in general. It's just too much for them. So, this is a study on test anxiety. So, basically, they did an experiment on so many kids to see if they use this method of dynamic testing on kids if it reduces testing anxiety. The study investigates the potential effect of dynamic testing for gifted and average ability students. A quote from the article is, "We compared the progression path from pre-test to post-test in both dynamic trainings and an unguided practice group. We expected the main effect and condition in a hypothesized children received dynamic testing would show more progression of analogical reasoning than children who received unguided practice only." The participants design. So basically, they took 113 children, 54 boys, 59 girls, ranging from the age 7 to 8 years and 9 months of age. The children were in the Netherlands and attended mainstream primary school. All the children were in gifted programs. So what this means for a gifted program is they had to be in the 90th percentile on a Raven progressive matrix test. The pre-test session 1 and 2 were enable comparison between statistics and dynamic progression. And after the post-test, all children were asked to complete the children's test anxiety scale. So basically, they were given pre-test 1, pre-test 2, post-test, and then asked to test for their anxiety. General procedure for children were in the current study were tested once a week over a period of 5 consecutive weeks. So they're tested 5 times once a week. And the tests look like simple things like they were given a blank sheet with shapes on it, and they were expected to name the shapes. Yeah. Analysis of the study. There was no significant difference between the Raven test scores, pre-test 1 accuracy scores, and test anxiety. Test scores generally showed higher rates of progression across the test session than children with higher initial scores. The results revealed that children who were trained dynamically showed more advanced progression. So if they had already been testing well, they showed progression of that well testing. Um, but there was no really conclusive data on if it improved test anxiety. And that's my big bibliography. Thank you for listening, and I hope everybody learned something today. Bye bye.